welcome to today's segment of the Case Manager Show. I'm Shirley Tabb, your host, and we are continuing our series on how to get the most from your Medicaid home health services. And I am so proud to get some information that I'm going to share with you through the courtesy of Families USA here in Washington, D.C. The District of Columbia has been among the nation's leaders in ensuring that seniors and people with disabilities are able to receive long-term care services in their homes and communities. The health reform law signed by President Obama on March the 23rd, 2010, includes several new programs that will allow the District of Columbia and other states to provide home and community-based services through Medicaid, which is the primary payer for home health care services. Through the Reform Act and laws, states and the district will be able to do even more. And that's really wonderful. That's good news. And according to Families US Today, there are 5 good reasons why states and the District of Columbia should not cut home and community-based services. First, cutting home and community-based services can cost the government more in the long run because generally it requires much more money to keep people in nursing homes or for institutional care as opposed to leaving people in their homes and communities where they can age in place. Number 2, cutting home and community-based services can be bad for the economy because it can cut or get rid of jobs for people who provide home health care services. Third, cutting these services increases the burden on informal caregivers, which has implications for U.S. businesses and the general economy, because when caregivers take off from work to care for loved ones, it costs money for the company to pay them while they are on leave. Fourth, cutting home and community-based services runs counter to consumer preferences. People prefer to remain in their homes and communities where we know that they do better. And number 5, the 5th reason we should not cut home and community-based services may involve breaking the law. It could violate the Supreme Court's Armstead decision. States and the District of Columbia government must have a plan for ensuring that individuals with disabilities are placed in the least restrictive environment. And that can also cause lawsuits and cost even more money for the government. So we are hoping that our home and community-based services are not cut. And I am so glad today to introduce to you 2 of my guests for this show, Ms. Sharon McAllister, who is a home health care recipient, and her sister, Dolores Mead, who is one of those informal caregivers that we talked about. And they are going to talk to you today about just what home health care in the community in Ms. McAllister's home has done for her. Hi, Sharon, and welcome to the show.
Hi, Shirley. Thank you.
You look wonderful today, too.
Thank you.
How long have you had your services now?
About 4 years.
About 4 years, yes, because I remember when I first met you and you were very ill.
Yeah.
You were very ill, and you really, really needed this program. You needed the home health care. You needed the case management. And I remember I was your initial case manager. And I remember when I told you about the Center for Independent Living, and I made that referral to Mr. Walters, and your life has not been the same since, has it?
No, it hasn't. It's improved quite a bit.
It's improved quite a bit. That is wonderful. Tell us a little bit about your home health services and how it's been and how it has changed your life so positively.
Well, with me being blind and the different things that I have that's wrong,
Yes.
my aides, I have aides with me 16 hours from the services. I get
Yes.
16-hour care.
Okay.
And that's from 8 o'clock in the morning to midnight.
So you have two shifts, one from 8 to 4 and one from 4 to midnight.
Yes.
All right.
7 days a week.
7 days a week. Very good. And so what does the aide do for you during this 16-hour period?
Well, they help me dress, make sure that I wash correctly, help me. They do my cooking for me because I can't cook because I start fires.
Yeah, well, we don't want you to do that now, do we?
Nope.
Okay.
And clean. They go with me, especially when I have to attend doctor's appointments, which a lot of times I may have 20 appointments in 1 month.
Wow. 20 appointments in 1 month.
Yeah.
So therefore, your home health aide is very important to you and an integral part of your life.
Yes.
Now, Dolores, you are what we call an informal caregiver because you have not been trained to do this, yet you love Sharon and you were doing all you could to help her before we were able to get the Medicaid waiver services. So how has your life changed since we got the service for Sharon?
Well, it changed a lot because there was so much on me taking care of her, and I quit my job to care for her for about 4 years, and then we got the service, and thanks to you, Shirley, and get the aides to come in, so then I didn't have to go as much, to the doctors and things. It was hard in the beginning because she still wanted me to go.
Sure, she was accustomed to you
me
being
going and to the doctors and stuff. But I still go to the doctors and things with her for paperwork and all that. But the aides has really been a big help. The cooking and cleaning and going to the grocery store, laundry, all those things, and it really helped us.
And those are some of those are all of the things that the home health aide is responsible for doing.
Yes.
And I'm so pleased to know that your services have been working out. And I know I have been to Sharon's, to your home, to do recertifications to make sure that there's no interruption in the services. And I have met the aides, and I know how much Sharon, I know how much you love your aides.
Yeah.
Yep.
And how much, and you all are just like, you're very close. You enjoy them. You appreciate what they do for you.
Yes.
Now, let's talk a little bit about a service that we did introduce you through to as part of the case management component with that referral that I made about 4 years ago to the Center for Independent Living. And how's Mr. Walters? Is he still there?
Yes, he's still there joking.
He's still there joking.
Yeah, he likes his jokes.
Okay, so tell us a little bit about what you all do at the center there, the Center for Independent Living. That's where people who have sight impairments go for training. Is that right?
Yes, this one is for older people who are 55 and older that are blind. And they teach us about our money, how to count it, how to put it up so nobody can steal it from you when you're out in public.
That's important.
You know, they teach us cooking. We learn different foods because with the loss of our sight, we can't see our food. And so we have to learn how it feels and smell, because everything have a different smell. And we also be learning, we're also learning computers and Braille. And we learn how to walk in public.
And I've always seen people, when I see people who are blind and they're out on the streets and they are just going along just like I am just always so impressed. I just think that's incredible, and they actually teach you to do that.
Yes, we have a cane. A lot of people call it a stick, but it's a cane. A stick does not bend.
Okay.
Our canes can bend, and we fold them up.
Okay. You came in here in the studio today with one.
Yes.
Okay.
Would you like to see it?
Yes.
Okay. This is how it's folded.
Okay.
To unfold it, you take this off, and it clicks together like this.
Yeah.
And you do a shoulder to shoulder sweep.
Okay.
And that tells you about the cracks in the street or and what's in front of you, so you don't trip and fall. And we learn, in which I've showed a lot of people, that when you walk, if you're walking with someone that is sight,
yes,
don't have sight,
yes,
let them hold your right arm and walk directly close to you.
Okay.
So they move when you move.
Well, you know what? I'm going to bring you back on the show just so we can talk more about how people who have sight impairments thrive every day and how they learn the survival skills that it takes. And I'm sure that they are doing a wonderful job over there. You give Mr. Walters a big hug for me when you see him again. And we are going to wind down this segment. I thank you all so much for coming in.
You're more than welcome.
Thank you.
Thank you.
It's been so good to see you, Sharon. Give me your hand. Let me just, I so much appreciate it. I so much appreciate it. And I'm so glad to see you looking so good.
Thank you.
And both of you. Thank
All right.
you. Thank you for coming.
Thank you.
You're more than welcome. We'll be right back.